Hello, everyone, and welcome to this webinar. If you haven't already, please go ahead and complete the pre-webinar survey. That goes for folks who are also watching this recording after the live webinar. The web link is go.umd.edu/mdh-hl-1-pre. Thank you.
Hi, do you have the recording going already?
I do, but I can trim this first part. So.
Oh, okay. All right. So you have the slide. Do I need to still pull up the slides?
Yes, since you want to be the one controlling the
Okay.
advance.
Is this the one 812 final?
That's correct.
Okay. All right.
So when you're ready, I can give you the. I
Okay.
can give it to you now. I can give you presenting.
Okay, I'm ready.
Privileges. Oh, you can't see me, can you? It's okay.
But I need to see. Oh. Good afternoon, everyone, and welcome to the inaugural webinar from the Herschel S. Horowitz Center for Health Literacy at the UMD School of Public Health. This is the first of several webinars that we will be looking at health literacy and chronic disease programs, so we're very happy to have you here. Before we begin, a few housekeeping details. Please, if you haven't already, complete the pre-webinar survey, and there's the URL. After the webinar, you can request the slides from this URL. As an attendee, you are automatically muted, and we are asking you to use the Q&A box if you have questions. If you're having any trouble with audio, you can always call into the webinar, and the phone number and the access code is on the slide. So as I said, this is the first of a set of health literacy webinars on health literacy and chronic disease for the Maryland Department of Health. You can sign up for the other webinars by going to this URL, go.umd.edu mdh-hl-training-signup. So today we're going to be looking at some foundational plain language techniques for public health communication. As I will talk about in the webinar, plain language is a technique for achieving health literacy. We'll talk a little bit about health literacy, but you'll be hearing a lot more about it in the rest of the webinar series. So why would we want to use plain language? Well, the first reason, of course, is because we want other people to understand us. Plain language makes language overall more accessible. I just want to start over.
Okay, no problem. You can go right ahead and start over as many times as you want. The main thing, also with the pre-webinar, we can say, the survey, we can say that even if you're watching this,
you can do it.
Yeah, even if you're watching this as a recording, we ask you to please also do the pre-webinar.
Oh, okay. Okay.
And yeah, take a deep breath, do whatever you need to do, center yourself. If you need to look through the slides again, that's fine. No worries.
This is why Bob Gold said, don't ever record anything in longer than 10 or 15-minute chunks. Because I'm already thinking ahead about, yeah, I don't know why. I don't like doing recordings. Okay.
Okay.
All right. Well, good afternoon, everyone. Welcome to the inaugural webinar from the Horowitz Center for Health Literacy at the UMD School of Public Health. We're very happy to have you here this afternoon. Before we begin, a few housekeeping details. First of all, please complete the pre-webinar survey, and even if you're watching this as a recording after our broadcast date, we are still asking you to complete that survey. After the webinar, you can request the slides by going to this URL. We have muted you as an attendee, and we're asking you to use the Q&A box if you have questions during the webinar. If you're having any problems with audio, you can always call in and listen to the webinar as well. As I said, this is our inaugural webinar in a set of health literacy and chronic disease trainings that we've created for the Maryland Department of Health. You can sign up for the other webinars at this URL, and we'll be providing the URL and the schedule again at the end of the slide set today. We're beginning with a webinar on plain language techniques for public health communication because they are such a key technique for health literacy work. We will be looking at a number of different plain language techniques as well as examples that relate to chronic disease or diabetes specifically. We can't cover all of the techniques, but we're highlighting key ones that will really make a difference in the clarity of your communication. We're going to be looking at what plain language is and why it is so important. Again, looking at some key plain language techniques and some examples, and then offering some next steps that you can take after this webinar. So why should we use plain language? The most obvious reason, of course, is that we want people to understand us. That is the reason that we are communicating to begin with, is because we have some information that we want to share or recommendations, or we're trying to motivate or persuade someone to do something. But the overarching goal is to help people understand us, and plain language is an important way to do that. We also use plain language because we want to show respect for our audience. If we are communicating in a way that is difficult or challenging for them to understand us, that is being disrespectful. And so when we take the time, make the effort to make ourselves clear and understandable, we are actually being respectful. We also know that we're all very busy. No matter what kind of lives we have, we're all juggling many, many things, and we don't have a lot of time to waste trying to interpret difficult and wordy documents. And plain language is a technique that helps us read quickly, find the information that we need, and also in our digital age, we spend a lot of time scanning and trying to find key bits of information, but not reading word for word. We know that people offer many objections to plain language, so we want to run through a few of those and just try and dispel those ideas from the very beginning. The first one that we hear a lot is that people say that plain language is dumbing down their information, that somehow they think that writing clear and simply means making information simplistic. I think in the examples that we're going to show you today, you will see that it's far from simplistic, that you can actually be quite sophisticated in the way that you are presenting information and still getting your point across using these plain language techniques. People also tell us they don't want to take the meat out, that somehow by using plain language techniques, we're telling them to remove all the relevant information. And actually, that's the opposite of what we're doing. What we're trying to do is clear away all of the clutter, all the extra wordiness, the long sentences, the words that are distractors for people, and actually help your readers or your listeners see what that meat is. So plain language is actually the opposite of taking out the meat. We're actually helping the meat become more visible. People say, I don't have time. And I will tell you that in the beginning, when you're first learning plain language techniques, it might take you a little bit more time, just as it would with any new skill that you have. But over time, as you practice these techniques, as they become second nature to you, you will not be spending more time. In fact, it actually makes it easier because you're much more clear and focused on what you're trying to communicate. People say, I don't want to be imprecise. I have reviewed, edited, rewritten, created a lot of materials during the time that I've been working on health literacy. And what I have found is actually that the more technical or jargony or wordy materials that I've tried to work with are the ones that are actually more imprecise. Plain language really brings a focus and a clarity to what you're trying to say, and it actually increases the precision of what you're trying to communicate. Because again, it's clearing away all of that unnecessary verbiage that is really just getting in the way of trying to get your main idea across. We often have people tell us they're using Q&A formats already, so they must be using plain language. And we want to show you that there are many alternatives to a Q&A format. And in fact, we don't recommend or often offer people Q&A formats for a simple reason, is that the question format, even though it's very natural that as humans we ask questions and offer answers, the question and answer format actually takes more cognitive processing time because the question is not providing any useful information. So we're going to show you how you can use headings to actually provide more information more quickly to your readers. We sometimes hear from people that they have very well-educated patients who always understand what they say. And usually my response to that is to suggest that they actually do a focus group or some interviews or even give some sample materials to their patients and really listen carefully to what their patients are understanding and taking away, because you will find that even well-educated and what appear to be savvy individuals can really struggle with health information because a lot of it is confusing, it's new, and not easy to understand. And finally, the lawyers or fill in the blank won't let you. And you will find that if you start looking into the plain language literature, that there are actually many lawyers who support plain language, that law students actually get trained in plain language writing. So lawyers themselves do understand the importance of clear communication, and they will oftentimes be your allies in trying to communicate clearly. So you can see from the previous slide that all of those statements began with the pronoun I. And what we're trying to show you with plain language is that it shifts the focus from what you, the speaker, want to say to what your audience needs from you. So on the left-hand side, you can see that this is this very I-focused communication. What do I want to say? How do I protect my interests? How can I impress you with my big vocabulary or my large body of knowledge? And oftentimes that's the type of communication that really causes confusion, that people find too dense or wordy or difficult. And plain language offers you the opportunity to have audience-focused communication. You're thinking about what your audience wants to know, how you can serve your audience's interests, and how can you clearly express what the audience needs. So it's very much shifting that focus from you, the speaker, to the audience and what the audience is trying to get from this communication. So plain language, what is it? Plain language is communication that your audience can understand the first time they hear or read it. I've already used the phrase cognitive processing a couple of times, and what that means is the amount of mental effort that it takes for somebody to actually try and interpret the words or the images that you are offering them. And by using plain language, we reduce that cognitive processing burden or demand, and we make it easy for them to understand the first time. Plain language helps people find what they need, understand what they find, and then ultimately use this information to meet their needs. Because as adults, that's what we are focused on, is we have an information need, and we are using that information to help satisfy that need. And if it does not satisfy that need, we move on and try and find something that does. So the bottom line on plain language is that we are trying to create information that is more understandable, it's more credible, and more actionable. And as a speaker or as an information provider, we know that credibility is essential. During COVID-19, we've seen how challenging communication can be when you have sources that are not credible. People end up very confused and concerned about what to do. So maintaining your credibility as a communicator is essential. And you make yourself more understandable and your information is more useful and able for people to take action on it. So I mentioned at the very beginning of the webinar that plain language is a health literacy technique, and our framework for the health literacy work that we do is the National Action Plan to Improve Health Literacy. The core principle from the National Action Plan is that health information should have 3 attributes. It should be accurate, it should be accessible, and it should be actionable. And you will hear that word over and over about actionability because, again, as adults, we're trying to get information to answer our questions and solve our problems. And so if it's not helping us take that action, we oftentimes are not going to devote much attention or consider that information that relevant. We've, again, during COVID-19, seen the problems when people are offered inaccurate information or when they are using social media channels or peer-to-peer communication, and there's inaccurate information that's either intentionally or unintentionally being shared. People end up not just confused, but actually maybe taking actions that can interfere with or actually harm their health. And then accessibility covers a wide range of characteristics, but it's mainly about making information available to the broadest number of people. So this is just a graphic of the 7 goals in the National Action Plan. We're focused today on the goals related to health information creators and distributors because that's what we're talking about as a plain language communicator, that you are making choices as a creator of information, as somebody who is disseminating information in your communities or through your organizations. And what we want to do is make those choices visible to you and show you how plain language techniques and the other techniques that will be covered in the webinar can help increase health literacy, not just at the individual level, but at the community level. We're also contributing to the goal on clearer communication within healthcare systems, as well as from government agencies, as we know that many of you work in health departments or perhaps other government agencies. And probably many of you have some affiliation with a community, faith, or social information service based in your community. So you can see that we're really touching on many of these national goals by focusing on plain language and other health literacy techniques in this webinar series. The definition that we use for healthy people, or for health literacy, comes from Healthy People 2030. And the focus here you'll see is on what we do as a society. So those bubbles in the previous graphic represent different sectors in society and their roles that they have in being health information creators and providers. So we as a society have a responsibility to provide accurate health information and services that everyone, that all people can easily find, understand, and use to inform both their decisions and their actions. So you can see this is not about an individual and whether an individual is a weak or strong reader, although that is part of the equation, but it's much more about a structural understanding of health literacy and what we do in terms of how we create and provide information to communities and individuals. So let's turn now and start looking at some of these plain language techniques and the examples of how you might use these in chronic disease communication. We're going to look at 3 sets of techniques. Techniques to organize that, again, have this audience focus. Then we're going to drop down and look very specifically at words and numbers. And then the last one, techniques to make information easy to find. So when you're organizing to serve your audience, you begin by knowing your audience and purpose before you begin. We have a tool that we use, the CDC Clear Communication Index, and the opening questions before you ever start even writing your first word or thinking of your first graphic is to identify both your audience and your communication objective and think very concretely about the health literacy skills of that audience. And that may take a little bit more time and thought than you expect, because the general public is not specific enough for most health materials. You really are trying to reach a much more targeted group of people, whether that's patients in a practice or people who visit a clinic or people that you want to get to enroll in a particular program or people who are already in a chronic disease program and you're trying to encourage them to stay in and finish the program. None of those are the general public. All of those are much more specific. And that's the kind of audience focus that we want you to have when you think about these materials. The next thing you need to do is put your most important message first. And again, that's because people have limited attention and they're going to look at the beginning, whatever the beginning is, no matter what your layout is, however you've laid it out or designed it, they're going to look at the beginning, and you need to put your most important message first to make it easy for people to find in case they don't read any further or don't have enough time and end up putting it aside. At least they will have gotten the most important information because you put it in a very prominent location. And then lastly, you put the information in descending order of importance, so like an inverted pyramid, if you will. And so what that means is your very motivated readers will get all the way to the end of the material and they'll get all of that great background information that you want to share. But other people who maybe don't either have enough time or attention span, or maybe they have weak reading skills and it just takes too long for them to get through the material, they will at least have gotten the key information because you put it in descending order of importance. So when you think about audience and purpose, a very handy question to use is why? Why do you want to communicate this information? As the speaker or the writer, you obviously think that information is important. But again, if you're thinking about it from the audience's perspective, there's usually a reason. You want them to either look for more information about that topic, or you want them, maybe you're trying to change someone's attitudes or affect their beliefs, or encourage them to do more information seeking, or to perhaps take the first step in a series of behavioral changes, right? So you need to think very concretely about what you're trying to communicate and why, because that will inform, the order of the information and how you present it. So these are some of the possible purposes that you may have. You might want to promote a program and help people find out how to enroll. You might want to help motivate county residents to look for diabetes or other information. You might be trying to communicate with providers and offer them tips on how to talk with their patients about enrolling in a program. Or you might have data that you want to share with other organizations in the community to help with program planning as part of a coalition or a coordinated effort in the community. But you can see that each of these different purposes would have a different audience and a different communication objective. So here's an example if you were trying to offer tips to providers about informing their patients about a program and encouraging enrollment. So a possible title could be "Help Your Patients Enroll in Prevention Programs." And as you will see as we look later at pronouns, if you have carefully defined your audience, those pronouns, those personal pronouns are going to make sense. If you've indicated in other ways in the material that this is for providers, you could use photos, you could say something in another part of the material about how this is for providers to talk to their patients. But that's how the your makes sense in that context because you're directly addressing the provider. So help your patients enroll in prevention programs. And you could open with something like, your patients depend on you for accurate, useful information about their health. They want you to share information about helpful programs and encourage them when they participate. Use these tips to educate and encourage your patients. And so this opening section has set up what's going to come next. It's going to be those tips on how to educate and encourage your patients. And if you're tempted to stray away from that and offer other things, then you need to go back again and think about what the purpose of your material is, because as this is structured, the only information that should come after this would be these tips about how to educate and encourage your patients. So these would be the other things that you could elaborate on. You could talk about why they might be at risk for obesity, diabetes, or heart disease, and how these conditions are quite serious. This might be part of that motivational effort. Explain the programs that they qualify for and why, because again, we understand programs because we're professionals, we work with programs all the time, but a lot of people don't. And so, one program may sound like another. And so explaining what the programs are and why you're recommending that they qualify for a specific one can be very helpful to people. Directions about how to enroll. That's often taken for granted that somehow we know how to work our way through all the steps in an enrollment process. But giving people that very specific information, or even offering someone in your office who can help, or other supports that can help people with enrollment can be very motivational. Explain to patients or participants what they can expect in the program and why they will benefit. And then, of course, saying a little bit about why this program is so effective, and then explaining a little bit about obesity, diabetes, and heart disease if you think that's important. But you can see that we've inverted the normal order. We've not opened with a lot of definitions about health conditions, because that forces people to just wade through a lot of very descriptive information. We've opened with, or we're proposing that you open with information that really catches the participants' attention and helps them see why they might be interested in and benefit from being part of these programs. Here's another example. This is actually an excerpt from a CDC infographic, but this is how we would suggest organizing this information, because it talks about the different steps that somebody might need to go through. If the overarching message is to prevent type 2 diabetes, the first step, of course, is to find out if you have prediabetes or diabetes. And so that first step then is seeing your doctor to get your blood sugar tested. There are these lifestyle changes that you can make in terms of eating healthy, being more active, and losing weight, and then joining a program. So there's a series of steps, but they're organized in such a way that finding out if this is even something that you need to be focused on is that first step. Now we're going to take a look at more word level, and also at some numerical examples, and how it is that words and sentences and phrases can really get in the way of people's understanding and taking action, and how you can use these techniques to make information more understandable. So these are some of the techniques in how to pay attention to the words that you use. We're going to show you a few examples of each of these. So the first one is about writing in active voice, and we'll talk about the difference between active and passive voice. I've already mentioned the value of pronouns. We'll say a little bit more about that. We'll show you some examples of keeping sentences short. In a webinar like this, it's a little more challenging to work with paragraphs, but the same techniques apply to paragraphs. And also the importance of choosing familiar words and numbers for your audience, again, because it makes it that much faster for them to figure out what you're talking about. So we talk about active and passive voice, which may, be a distant memory from your grammar classes of long ago. But the basic distinction is that active voice shows who or what is doing the action up front. So your sequence is really subject and then active verb. So in this original, this is passive voice writing, because it says the diabetes educational program was scheduled. We don't know who scheduled the program. We just know that the program was scheduled by a person or an organization. So that's what makes it passive voice, is that we can't tell who or what is doing the scheduling. So a rewrite into active voice would be the hospital scheduled the diabetes educational program. So we've made it clear the who, which is doing the action of the scheduling. And remember what I said about credibility. This is an example of how you might actually be reinforcing your credibility, because if it's a hospital with a good reputation that people are comfortable going to and see as a trustworthy source of information and programming, knowing that it was the hospital that scheduled the diabetes educational program might actually make it more attractive for people to sign up. But in the original, it would be very difficult to tell, was this just some program that an organization that just sprang up overnight basically and was offering it in the community, but nobody really knew anything about it or why they would be a trusted source for this information. So here are some more examples of passive voice. You'll recognize passive voice when the person doing the action follows the verb. So in this example, Arlene was selected by her boss, right? So the boss is the person doing the selecting, but the placement of boss is after the verb. So the active voice would be the boss selected Arlene. Anytime you see a form of the verb to be, so in this case, the COVID testing program will be offered by the health department. Again, the health department is the entity offering the testing program. So you'd want to put that at the beginning in front of the verb so it's clear that the health department is offering the COVID testing. Here's a little bit longer example. So the original read in 34 words, easy access to information and resources concerning diabetes prevention programs and low-cost healthcare services for county residents has been made available. So there you go, right there. That's the passive voice, because we don't know who's been making this information and the resources available on a new website developed by the County Department of Chronic Disease Promotion. So again, the entity doing the developing or providing that information, that's coming at the very end of the sentence and following the verb. So that's what makes it passive voice. So a possible rewrite would be the county sponsors a website with diabetes prevention and low-cost healthcare information and resources for residents. So it's making clear that the county is the source. What are they doing? They're sponsoring this website. What's on the website? Diabetes prevention and low-cost healthcare information and resources. Who's it for? It's for the residents of the county. And that took 16 words instead of 34 words. I also want to point out that in addition to just making it much easier to read and faster to understand, you can see that when you are much more focused in your writing, you create a lot more white space and a lot more room in your materials, because if it takes you 34 words to say something that you actually could say in 16 words, you can fit in more information possibly and still have more white space in your material, making it more visually attractive. I want to take a quick look at pronouns. There's a lot that we could say about pronouns. But the key features of pronouns is that they allow you to speak directly to your audience. They make it seem like you're personalizing that information. It makes information feel more relevant to the person who's reading or listening to it. And as you can see already in some of the examples we've shown you, it really helps eliminate wordiness. So you can, these are some of the core techniques for pronouns. You can use we to refer to your organization once you have made it clear who your organization is. And one of the ways you can do that is with your logos or with other branding elements in your material, so that you don't have to constantly say the full name of your organization. I know that when I use the full name of our organization, the Herschel S. Horowitz Center for Health Literacy at the UMD School of Public Health, that takes up a lot of space when we write that out. And so what we do is we use our branding template, and so our name is in that template, and we may say it at the beginning, but thereafter we would refer to ourselves as the center, or we would say we, so that we're not constantly taking up a lot of space and really creating a reading burden for people by saying our full name all the time. When you're talking to the reader or the listener, you can use you. If you are using a Q&A format, again, we don't strongly recommend that, but some people really feel like that's the best format for them. But when you do use that, you can use I in the question. For example, like, how do I enroll in the program? And then in the answer, you can say you can enroll in the program by doing X, Y, Z. As I said, make sure you define who we and you are, because sometimes people forget and then they start mixing different we's and you's within the same text, and that can become very confusing. You will notice that we're not talking about the use of gendered pronouns here. These are ones that you can use to refer generally to a wide variety of audiences, but if for some reason you do need to use gender pronouns, you can also use the plural they or them. That is becoming much more common in regular use. So here's one very short example. The original: anyone can get coronavirus from contact with an infected person. So again, while that's true, that sort of makes it very general, and someone can say, well, that's probably not me, that's not really going to affect me. But you can simply change it and use a pronoun. You can get coronavirus from being too close to a person with a virus, make it seem much more personal and much more relevant, and cause someone to pause and think, well, maybe I should take a closer look at this. We strongly encourage you, as you can see in the example so far, to really keep things short and focused. At the very beginning, I said there's a difference between simple and simplistic. I think you can see in the example so far, we've been conveying the relevant information without making it simplistic. So shortness is about being simple and aiming for 20 words or less per sentence. Again, making information easier to understand and really allowing you to highlight your main ideas. We do offer the caution that if you get too short and you kind of get into this repetitive short structure, you can introduce a choppiness into your writing. I know that after years of doing plain language writing, sometimes my emails can get very choppy because of that. So it is a real thing to pay attention to, but I think, with practice, you can write with a variety of sentence structures, still aim for 20 words or less, and have a nice flow to your writing. So here's one example. The original, the National Diabetes Prevention Program, is ultimately a lifestyle change program that provides an environment where individuals can learn, laugh, share stories, try new things, and build new habits, all while lowering their risk of type 2 diabetes and improving their health. So that took 43 words to say, about more than double what our recommended sentence length is. But there are ways to make that to keep that same information, eliminate some of the wordiness, and create some shorter sentences. So we broke this into two sentences, one of 18 words and another of 11. So the National Diabetes Prevention Program lets you learn, laugh, share stories, try new things, and build new habits. As a bonus, you're lowering your risk for type 2 diabetes. You can see that we also introduced the pronouns, again, making it more personal. So again, the original was talking sort of more generally about individuals and lowering their risk. And we personalized it by introducing pronouns. As a bonus, you're lowering your risk for type 2 diabetes. So this is an example of how you might use multiple plain language techniques in one rewrite of a sentence. Here's another example. In the original, it said the 12-month group-based program consists of 6 months of weekly sessions, followed by 6 monthly sessions led by a trained lifestyle coach who facilitates a small group of people with similar goals. That took 32 words. Again, about slightly more than 50% longer than what we would recommend. You can also think, when you start to see a series, which is like 3 or more things, you could create a bulleted list. In this case, we went ahead and kept with the sentence structure, but a bulleted list is also an option when you have a series like this. So the revision, again, using pronouns, creating 4 short sentences. You'll be in a group program for 12 months. In the first 6 months, the group meets every week. Then the group meets every month. A trained lifestyle coach leads the program. This is actually reflective of some actual experiences we had in some focus groups that the center did with people who were in DPP programs. We heard from them that they signed up, oftentimes not really understanding what the commitment was, that it was not clear. how long the program was and what to expect. So you can see with this rewrite with 4 short sentences, it's very clear about what the full program is, what that structure is going to be, and who's providing the leadership. I mentioned that lists can be a good technique when you have a series. This happens to be an extreme version of a list. I referenced earlier the CDC Clear Communication Index, and there's an item in the index that says your list should be no longer than 7 items. And 7 can even be too long depending on how complicated each of your bullets or your numbered items can be. This has an extremely long list of items, and you can see that they start to mix a lot of different things that could actually be grouped together. So for example, you could group together the things related to mental health issues or to physical abuse or other types of abuse or academic issues, right? There's clearly some subsets of characteristics within this long list of risk factors. And so this list really cries out for having some subheadings and grouping these factors together so that people can very clearly see which ones go together, because in such a long list, it's very difficult to kind of figure out what goes with what. So remember, 7 items or less, and sometimes even less than 7, depending on how complicated your bullets may be. So we said that choosing your words carefully is very important. That's often one of the first things people think of with plain language or health literacy techniques, is that it's really about the words that you use. So you are right that words are extremely important to how you communicate. Our recommendation is to always limit your jargon and acronyms, even in professional audiences, because we're increasingly working in an interprofessional environment. And so you may be communicating with professionals who have a different background than yourself. So they may not share the jargon that you are familiar with. And so you can still cause miscommunication in professional to professional communication. We encourage you to use the everyday and familiar words for your intended audience, right? So that will not be the same for every single audience. Contractions are fine, again, because they help create that conversational tone to your writing and your speaking. Here are some examples of some diabetes-related everyday words. So on the left-hand side are the more formal or potentially jargony words. And on the right-hand side would be the more everyday or easy to recognize words or phrases. So for example, instead of gestational diabetes, you could say pregnancy diabetes. Instead of blood glucose, you could say blood sugar. Instead of family history of, you could say a family member with. Instead of be more physically active, get more exercise. Or obesity is a risk factor for diabetes, you could say you are more likely to have diabetes if you are heavy. I know it's very comfortable for us to always talk about risk factors and people being at risk for things, but that's actually a concept related to probabilities. And in a minute, we'll show you some examples of numbers that are challenging for people to understand, and probabilities are one of the most difficult. So we often use the phraseology of you are more likely instead of talking about a risk factor. Some other examples of everyday words, we often like to talk about attempting to do something. You can use the word try. Instead of demonstrate, show, or prove. Instead of implement, again, one of our favorite words in public health is we're always about implementing things. You can use the word start, or in the event that, you can shorten that to if. Again, what you're really trying to do is use those more familiar everyday words to help people understand more quickly and with greater clarity. If you will recall at the beginning, I said that one of the common objections is that plain language is less precise. I think we're showing you that actually plain language is more precise, because when people get bogged down in unfamiliar terms or wordiness, the meaning really starts to fall apart. You can find more examples of everyday words in the Federal Plain Language Guidelines. Use simple words and phrases. If you have not downloaded a copy of the Federal Plain Language Guidelines before this webinar, I would strongly encourage you to do it afterwards, because there are many more techniques and examples than what we can offer you here today. Here's another example of how to use everyday language in context. It is extremely concrete. So you can see under the weigh yourself, again, very specific directions using very specific language. Try to weigh yourself once a week. You can adjust your eating and activity as needed. It's easier to get back on track when you've gained 2 or 3 pounds than when you've gained 5 or 6. And then you have a visual to the right of that to support that. Again, about physical activity, being very specific about what that means, giving a visual to indicate what an example of that might be. So plain language is very much about trying to ground it in people's what's familiar, what their everyday experience is. And again, that's going to vary by audience. In this case, this material is speaking to people who are trying to lose weight themselves. If this were to providers or to program planners or to administrators, it would have a different focus, a different communication objective, and the language would be different. Not to say that it would necessarily be more complicated or jargony, but the focus would be different. So this, again, same basic information, but you would adjust it for the relevant audience. Another way to use familiar language is to let people speak in their own words. So this is from a CDC webpage that has a number of individuals who participated in programs talking about their experience in their own words with short video clips. I mentioned that numbers can be just as challenging, if not more, than words. In fact, in the national literacy studies, those studies have consistently found that people's numeracy skills are weaker than their reading skills. So if you know that the population that you're trying to reach has weak literacy skills, you need to understand that their numeracy skills will be even weaker than that. So what we know is that decimals, fractions, and percentages are challenging for many people, even people with higher levels of education. But using an expression like 1 in 10, which is very specific and concrete, people can imagine what 10 is as a set. That's familiar to them. They can imagine what 1 out of that 10 is much easier than any of those other forms of expression. We do want to remind you, though, if you use that type of numerical expression more than once in a material, to keep your denominator the same. So rather than saying 1 in 10, 1 in 3, 1 in 4, which is basically forcing your reader to try and figure out how do those numbers relate to each other and convert them, you need to stay with the same denominator throughout. So that may cause you to think about which numbers you absolutely need to include in your material to help explain your main message. Adding visuals and explanations helps people even when you use these more basic expressions. So for example, a 1 in 10 risk or chance means that 1 person would get the disease and 9 would not. These numbers come from studies of large numbers of people. You can see that that's a more familiar way of saying population studies, but you want to help people understand that these numbers are reflective of more than just any specific 10 group of people, that this is, again, trying to get at this notion of population-based probabilities without using any of that jargon. The last group of techniques that we want to look at are about making information easy to find. Again, the faster people can get to your information, the more likely they are to try and process it and figure out how it could apply to them. So we know that people skim and scan, so make your information quick. And these are all different techniques about how to do that. Chunks are just small blocks of text. They could be a couple of short sentences. It really depends on what the point is, but you want a chunk to be about one thing and one thing only. We talked a little bit about headings and how headings can be a much better replacement than a Q&A format because the headings themselves can actually deliver relevant information. And then you can use text boxes to call out information that you want to make sure people definitely see. You've seen in some of our examples how you can delete unnecessary words, sentences, and paragraphs. Again, all of that bogs down your communication, makes it much more difficult for people to wade through. And then you can use lists, tables, and graphs. Again, we can't show you a lot of those in such a short webinar, But there are other resources at the end of this webinar that you can dive more deeply into, and we'll show you a couple of examples. So here's one using heading and lists about the Prevent T2 program. So it has a very short introduction, and then it has this little header about who should sign up with a very brief explanation, and then a short bulleted list, right? So you could imagine if this were written in text, it would be much more difficult for somebody to wade through that long series of factors and figure out if any apply to them. When you use a bulleted list like this, it makes it very easy for people to scan and see if they fall into any one of those groups. You can see in this original that, again, it's a long sentence, passive voice. Efforts are focused on health system interventions to improve the quality of healthcare delivery to populations, as well as increasing clinical linkage. So whose efforts, what does this mean to focus on health system interventions? You know, a lot of ambiguity in this original version. So the rewrite, we improve how healthcare systems serve people who need high blood pressure and prediabetes programs and services. Again, here's a use of we in an organizational context. What are you doing as an organization? You're improving how healthcare systems serve who? People who need these services. Again, much shorter, much more focused, much easier to see what the organization is actually doing. Here's an example of a graph using some best practices. So very important to label your graph clearly. You can see that we put it in a horizontal descending bar graph. So it makes it much easier to see which is the group that's at highest risk, because it's very clearly visible at the top. You have your axes labeled. Again, you're just making it very clean, clear, easy to see what the relevant information is. So these techniques that we've been talking about in relation to writing, they can often apply to other elements of your visuals. So in summary, these are the three buckets of techniques that we've covered today: organizing to serve your audience, choosing your words as well as your numbers carefully, and using techniques to make information easy to find. The bottom line is that we're trying to help communicate more clearly with people that you're trying to reach, and that is often the problem that people bring to us. They say, we have this great program, we've been working so hard to try and get people enrolled, but we just can't reach the people that we're trying to reach. We hope that with this brief introduction to plain language today, that you've seen that the way that you communicate about your programs can actually be interfering with your goals and affecting the reach that you're trying to achieve. So these techniques can help you in your overall objectives as an organization in trying to expand the reach and get more people involved with the information, programs, and services that you offer. So what should you do next? Of course, practice, practice, practice. While it's great that you came to this webinar today, and we appreciate the time that you've spent here, at the same time, when you walk away, you need to take these techniques with you and begin implementing them immediately. Practice makes perfect, as they say, and I will tell you that it still, to this day, after years of using these techniques, I still learn something new every time I work on a material or do a presentation on plain language. You really have to practice these techniques over and over, because it brings a focus and a clarity to your language that you don't have if you just sort of say, oh yeah, I'll get back to that next time I work on a material. So practicing as often as with as many different kinds of communication formats as possible is extremely important. We would also encourage you to make time and make the effort to get feedback from your intended audiences on these materials. So these techniques will clear away a lot of the common problems. They will, if you happen to do focus groups or interviews or other kinds of audience testing of your materials, you will find that you will get much more relevant information when you apply these techniques first and take better design materials into your focus groups and your interviews. But these techniques can't substitute for audience feedback. They can get you a long way down the road, but you still need to hear from your intended audience about whether or not this material is working for them. We still encourage you to take that step, even when you become really expert at applying plain language techniques. These are resources that we would strongly encourage you to check out after this webinar and begin to incorporate into your practice. Some will allow you to just reinforce some of the plain language techniques that we've talked about today. Others will provide additional information. So for example, the NCI Making Data Talk will give you many more examples of graphs and charts and things like that. There are additional CDC online training courses that you can take through the platform called Train, T-R-A-I-N. And then, of course, we have the webinar series that we're going to be offering as well. There are a couple of glossaries if you get stuck thinking about everyday or plain language words. CDC has an Everyday Words for Public Health Communication glossary, and United Healthcare, the insurance company, has the Just Plain Clear glossary. The United Healthcare glossary has a lot more healthcare terms than the CDC glossary, which has more public health terms. This is our schedule for the upcoming webinars. All of the webinars will begin at 3 p.m. Eastern Time, and you can sign up in advance for any and all of them. Next week, we will be looking at how to create health information that people want to read even more specifically than we have today. So looking more specifically at some health literacy techniques for written information. That will be followed by a webinar on oral communication. Then we will look at health literacy techniques related to chronic disease programs and how health literacy issues may be interfering with the success of your programs and what you can do to address that. The next webinar will be about more engagement techniques to get people, make your programs more accessible. And then the last one will give you some relevant information about the connection between periodontal disease and diabetes so that you as diabetes educators can be more informed about that. Thank you for your time and attention. We have a post-webinar evaluation that we would like you to complete. You can join our center's email list and get all the news and information from the Horowitz Center for Health Literacy. If you would like to have a copy of these slides, you can request the slide deck by going to that URL. And of course, you can always contact us at our center's email address, healthliteracy@umd.edu. So we thank you for joining us today, and we look forward to seeing you at the future webinars.
All right, I'll make sure to cut it right there. You did it.
Yes, of course.
Okay. So I'll turn on my video so you.
So it was about what, 55 minutes or 50 minutes?
Mm-hmm. Yeah, 50 minutes. I think you started around 9:15, right around that mark.
Okay.
We had a 10 o'clock, and I knew your computer was going to bing at like the 10-minute mark before that, so I canceled it so that I wouldn't make that.
Oh, okay.
That would have been distracting, and it probably would have been off.
Okay, that sounds good. Well, have we covered most everything though? Because we had talked yesterday afternoon, right? After I covered a lot of things.
Yes. Give me one sec. I'm going to stop the recording.
Okay.